This week, the United States passed the tragic milestone of 100,000 deaths from COVID-19. While we try to provide the practical business implications of navigating this rapidly evolving environment in these video updates, we also recognize the very real human toll of this pandemic. We know that many of our clients are experiencing this toll firsthand. Whether you are personally mourning a loss, saving lives, or working to keep a business on course for people who count on you, we stand ready to help as we can. Hello, I'm Eric Zimmerman, partner at McDermott, Will & Emery, head of the firm's health law practice, and a principal at McDermott Plus Consulting. Today is May 29th, and this is the Friday News Flash Coronavirus Health Law Briefing. First up, on Wednesday, the Department of Health and Human Services Office of Inspector General, or OIG, released a strategic plan announcing intent to conduct oversight into how provider relief funds have been distributed and spent. According to the plan, the Inspector General intends to conduct audits of both HHS and funding recipients to determine whether relief funds were distributed and used appropriately. The IG also will be monitoring compliance with reporting requirements. Where necessary, the agency said that it will recommend recovery of misspent funds. The IG's announcement should be news to no one, but removes any doubt that the feds intend to actively examine use of these funds. Continuing with the Provider Relief Fund, there have been a number of notable developments since last week. First, HHS announced the distribution of $500 million to Indian Health Service facilities. The agency also extended the deadline for providers to accept and attest to received funds by 45 days, bringing the total time to 90 days. And last week, HHS also updated its frequently asked questions document, responding to questions about how providers should receive funds if they have recently been acquired by or acquired another provider. According to the FAQs, in the case of mergers or acquisitions, only the surviving entity with a currently billing tax ID number can accept relief funds. This means that providers must return any funds received under a TIN that was acquired or sold, and therefore did not provide care to a possible or actual COVID-19 patient after January 31st of this year. Additionally, in an organization that sold its only practice or facility in 2019 and is no longer providing services cannot accept payments and transfer them to the new owner. However, parent organizations are allowed to transfer relief funds to their subsidiaries at their discretion. Lastly, it's important to note that providers are eligible to receive payments that were based on 2019 Medicare billing, even if parts of their practice have been sold. These providers must still be able to demonstrate that their expenses or lost revenue have exceeded the payment. Next up, congressional Republicans and Democrats recently introduced competing bills aimed at protecting personal health information during the pandemic. Republican Senator Roger Wicker introduced the COVID-19 Consumer Data Protection Act. A week later, a group of House and Senate Democrats responded with a competing bill. There are a number of similarities between these proposals. They both identify organizations that must seek consent before collecting, using, or disclosing personal health information, even if this information is collected as part of the coronavirus response efforts, such as contract tracing. However, there are some key differences in their scope and approach. Notably, the Democrats' proposal allows consumers to bring lawsuits for alleged privacy violations. Their proposal also expressly prohibits organizations from using covered data for discriminatory purposes, including interference with voting rights and employment opportunities. These provisions are not included in the Republican proposal. If you are interested in learning more, look for an article just posted to our website. Now for the lightning round. 3 quick hits this week. First, Senate Democrats released a white paper advocating for coverage expansion during the pandemic. Key proposals include covering all costs for COVID-19 treatment, subsidizing COBRA premiums for recently unemployed individuals, and establishing a federal special enrollment period for people to purchase individual coverage. These policies will likely play a key role in negotiations on a future relief package. On Monday, the Department of Health and Human Services issued a report outlining broad goals for increasing the nation's testing capacity. This plan, which was required by Congress under the CARES Act, recommends that states to test at least 2% of their population by the end of June and take steps to bring their test positivity rate below 10%. The plan has faced criticism from Democrats and some public health experts who feel that these goals are insufficient and unenforceable. And finally, HRSA awarded $15 million to 52 tribal health organizations to help them prevent and respond to COVID-19 outbreaks in rural tribal communities. Those are the coronavirus health law updates for this week. For additional information or in-depth analysis about any of the topics we discussed, please visit our Coronavirus Resource Center at MWE.com/coronavirus. Please join us again next week for another edition of Friday News Flash. In the meantime, thank you to our clients on the front line of this pandemic. We appreciate you and all you're doing. Stay healthy.